Hello everyone, my name is Ashmit, and as you've probably inferred by the title, I recently finished my second year of medical school, which I'm really happy about. And firstly, I'd like to apologise for the lack of uploads. I mean, the last upload I made was about 10-11 months ago, so I really do apologise. And I'm going to lie to you again like I did last year. I will try my best to upload more this year. And I hope that's not a lie, because I have so many ideas. I mean, I was counting this morning, I've got 70 video ideas that I've had, and I've only ever uploaded 15 over the course of more than a year, which is really, really disappointing. I've got absolutely no one to blame but myself. But with that being said, year 2 of medical school was challenging, it was very hectic, and personally I was doing so much more outside of medical school that frankly made my life a lot more busy and more tedious, to be honest. So if you're watching this video, it's either because you're interested in applying to study medicine at the University of Leeds, you're either starting medicine this summer at the University of Leeds, or you've just finished your first year and you'd like to see what second year is all about. Regardless of the reasons, I will take you through the entirety of what we learned in second year, what placement was like, and I'll also review and reflect on my final exam results and how those went. I'll also go through what I liked and didn't like about year 2, not just from an academic side of things, but also in terms of how much spare time did I have to sort of like enjoy and socialise with friends, how much time did I have to pursue extracurriculars. So I'll also give you lots of study tips for year 2, because I think I did alright in my exams, so feel free to skip to the relevant sections as you please. So in term 1, year 1 of medical school, we didn't actually have a whole lot going on. But then contrast this to year 2, term 1 medical school, it's actually a little bit more intense. They throw quite a lot at you. So one of the modules that we start doing in term 1 is Essential Medical Sciences, and this can be abbreviated to EMS. It comprises of 2 main things, pathology and genetics. And the themes of pathology and genetics are spread over 5 themes in EMS, and we're basically looking at diseases and different biological mechanisms at a more cellular microscopic level. So at a more basic level, we'll be learning about the role of the departments of histopathology, microbiology, hematology, immunology. These are all sort of like branches, divisions of medicine that are very important to understanding what disease a person has, how to guide further treatment, and then also we'll be learning about the roles of autopsy and genetic counselling. And then finally, at a more cellular microscopic sciencey level, we'll be looking at cardiovascular and vascular disease. We'll be looking at heart failure, infections of the vascular and cardiovascular system in a lot more detail. And then also we'll be looking at things like genetic variation, chromosomal pathology, inflammation, immunology, tissue repair, metabolism. So metabolism would include things like inborn errors of metabolism, potassium, sodium, acid-base homeostasis and balance. And then also we'll be looking at things like neoplasia and cancer. So there's quite a lot going on in EMS, and unfortunately it's one of the most neglected modules because a lot of people believe that it's just not very important, and I cannot disagree more. I really enjoyed learning EMS, and I spent a lot of time on this module, not just because I liked it, but because it truly is clinically relevant. I mean, a lot of the topics within it, for example, things like metabolism that are very boring are actually very, very clinically relevant. Regardless though, I really like learning about the sciences at a more microscopic, deep cellular level, and I understand that a lot of people in the year found this module boring for that reason. One very valid complaint about EMS is that the amount of detail that they have on the lecture slides is a lot. And when you compare and contrast this to what actually comes up on exams, it just doesn't seem all that necessary. A lot of the modules in EMS, like the immunology module, it's far too detailed. There is just way too much stuff on there, and the questions they actually ask you in exams are quite basic, to be honest. So that is one very valid complaint which I will be passing on to the medical school for feedback. So moving on, we next have the research module, which we have not escaped from first year. We do still have a research module which is still called ENQUIRE in second year. So ENQUIRE actually becomes a lot more intense this year, and by intense I really just mean they do a lot more tutorials, a lot more sort of like teaching. So we have several weeks of tutorials that you must attend, and they teach us many very different important statistical methods. and then how to go about interpreting different statistics. Now, a lot of people did not enjoy ENQUIRE, and the reason for that is they think statistics are boring and it's probably just a waste of time, as I've heard from a lot of people. Now, I do understand that statistics and research are not for everyone. The vast majority of doctors will not do research. But then I do firmly believe that every single doctor should be able to know how to interpret research. This is important for a medical doctor or even a student to be able to do, as medical knowledge is constantly evolving, it's constantly changing. Every few years or even months, based on how rapidly things are progressing, we're always learning the new best way to treat a patient. So take something as common as treating high blood pressure, for example. So a few years ago, beta blockers were often first line, but now we've realized through new research and guidelines that medications like ACE inhibitors and calcium channel blockers are preferred for many patients. So if you're a doctor just following what you were taught in first year of medical school or third year of medical school about 10-20 years ago, you might be behind, and you'll still be prescribing your patients beta blockers when they're actually sort of like outdated. But if you know how to read and interpret new research, you can spot these new changes and actually understand why the treatment shifted. And that's the difference between memorizing fact and thinking like a new, updated clinician who stays current. And that's why knowing how to interpret research is just as important as doing it. So in ENQUIRE, there is more that we do. We get the opportunity to work with a real patient data set. So we're given real, actual patient data. And there will be very basic variables given to us, for example, things like age, sex, ethnicity, deprivation quintile, and then from a more medical side of things, we'll be given information as to whether or not this patient had diabetes, did they have cancer, did they have many other different cardiovascular conditions, and a few other things that I can't remember. This data that you've been given, you can interpret this data in a million different ways. You can create so many different research questions from this. For example, you can say, is there a link between ethnicity and diabetes? Is there a risk between diabetes and an increased risk for cancer? Or you can make things more complex and talk about how do cancer rates change as deprivation quintile changes, adjusted for things like age, sex, ethnicity, presence of diabetes, other cardiovascular conditions. So that's all things that you can do. Now, a lot of people didn't really enjoy this all too much, and there's very good reason for that. So in year one, we're introduced to sort of like very basic research work, but then this year, the data set that you're given, it's very vague in the sense we aren't ever told what type of cancer a patient has. We're only told whether or not a patient had cancer, which isn't very specific if you want to do more complex analyses, which I wanted to do. So we're not given details like what type of cancer a person had, what the grade stage was of the cancer. So the data we were given was very vague, but it's still good in the sense you are given the opportunity to sort of like apply basic statistics and then also make graphs and other diagrams from it. So it's okay. I mean, it's a good learning opportunity. There's definitely things they can do to make it more intellectually engaging for people, which was the biggest complaint. For that reason, people found it very boring, which is completely fair. Moving on to the next module, we started doing control and movement, which can be abbreviated to CNN. So control and movement can be broken down into two main things: control and movement. So movement basically covers everything related to musculoskeletal anatomies, physiology, and then we have a lot of clinical correlates as well, which I'll get onto very, very soon. And then control looks at the central nervous system and really just the nervous system in general, which I'll talk about later on. So movement covers everything musculoskeletal related, and it's going to be broadly divided into upper and lower extremity. So the upper extremity would include the chest, the back, which is all taught in very thorough detail, and then also the entirety of the arm, from the shoulder to the very fingertips. And we have also covered musculoskeletal and orthopedic injuries, and we've also learned how to do basic X-ray interpretations for injuries like shoulder dislocations, arm fractures, even hand fractures, nervous and vascular injuries. We've been taught those as well. We haven't been taught orthopedic injuries and X-ray interpretation in a lot of detail, which I'm sure we will do in our clinical years. That just makes a lot more sense. And then moving on to lower extremity, which comprises of the hip and pelvis down to the toe and everything in the middle. So the same as above, we basically covered orthopedic and musculoskeletal injuries, so very basic things like ankle sprain, which is something I'm very familiar with, and then more serious things like hip fractures, looking at things like avascular necrosis, femur fractures. So there's quite a lot we're taught. I personally really enjoyed movement. It definitely felt slightly overwhelming in the start, and there was a lot to cover, but then honestly, it's definitely manageable. Learning about movement, the actual anatomy and stuff. I mean, anatomy is really well taught at the University of Leeds. Everyone agrees, it's a very general consensus in our year, that the best thing at the University of Leeds is medical school is how they teach anatomy, is how they teach physiology. So control of movement was by far my favourite module. I think that's the case for everyone. They teach things very well. They have lots of tutorials, lots of lectures, lots of additional learning resources that you can use to build a solid foundation into your anatomy and physiology knowledge. So very well done. Hats off to Leeds Med School. So still in term 1, we have placement, and like in year 1, it is again only once a week, but now rather than having a half day of placement, we have a full day of placement. So in term 1, you'll either have a primary or secondary placement. So primary, for those who don't know, primary care is just GP. If you're watching in America for whatever reason, then that is family medicine. And then secondary placement is more in the hospital. So in term 1, you'll either be in primary or secondary, and then you will rotate as the year continues. So personally, I don't mind placement at all. I actually really enjoyed it. I actually learned quite a lot of cool things. I saw a lot of interesting cases. And I think building sort of like this early exposure through early placement in years 1 and 2 once a week is fine. It works, and I really enjoyed it. So next, moving on to ideals, which is the next module I need to talk about. So ideals, you either hate it or you love it. And for the vast majority of the year, including myself, we don't really like ideals. I mean, personally, I don't even know what ideals was about. I mean, yes, I do know what ideals was about, but I also zoned out the majority of the time. I didn't really enjoy it all too much. It can feel very boring, tedious. They wake you up on a Monday, or I think it was Friday morning at 9 a.m. To come in, and you've got to sit down and talk about things. And then this year we did a lot of stuff on patient safety, so that includes things like reporting mistakes and ensuring things don't go wrong in a hospital setting in the first place either. So they talk a lot about near miss or never events. So that's ideals. Nothing crazy, you just have to be there for ideals. If you miss, I think, more than 2, then you will be required to resit, and that's not fun. So at the end of term 1, we have this thing called PPIE. Now PPIE is an extension of the ENQUIRE module, so the research module, and it stands for Patient and Public Involvement and Engagement. It is a term used in research to describe the process of involving patients and the public in the design, conduct, and dissemination of research studies. So instead of simply conducting research on people, PPIE involves working with people who have experience with the topic being researched on. So in more simpler terms, you're not just doing a research project, but you're also involving other people in doing your research. Now, the way they've gone about this is very tedious. So I think in the last 1-2 weeks of term 1, they have lots and lots of teaching on PPIE. You've just basically got to sit through it. And then also you are put in a group, some people from your year and then some from the year above, so some third year and second year medical students. You come together and you have to make a poster on PPIE, and you absolutely never have to present it, you just have to submit it, and you have to be there for the entirety of the week. So I have no idea why the med schools decided to do this task. It was very boring, but I hope that changes in the future. Moving on to term 2. Now term 2 is where things become very intense, and the first new module that we start doing in term 2 is called clinical pathology. Now clinical pathology is very interesting It encompasses the basics about the day-to-day stuff you will encounter in a hospital working as a doctor. I mean, as the name suggests, clinical pathology is very much a clinical module, and it's divided into 11 main topics. So we'll cover things like core microbiology, which is where they teach us about the most common bacteria, fungi, viruses, parasites and prions. So we learn many of the common ones and how to treat them, and a little bit on how they present, which is very, very important. I mean, you're going to see infection basically all the time as a doctor. So it's very useful. It's a good topic. I really enjoyed it. And then you've got advanced microbiology, so that looks at the treatments for everything that I just listed above. So things like antibiotics. We'll also look at antimicrobial resistance, antivirals, antifungals, and a lot more. And this sort of like branch of microbiology, it's a bit more boring. I don't think a lot of people really liked it. I didn't like it too much either. So then we looked at kidney and urinary tract pathology, so a lot of common diseases of the urogenital system, infections, congenital disease, cancer, treatments, then respiratory pathology, so that includes common infections like tuberculosis or other bacterial infections like Staphylococcus, Streptococcus, to even much rarer ones like Pneumocystis jirovecii. I hope I'm pronouncing that right. I don't even remember how it's spelled perfectly, so I do apologise if I've butchered that pronunciation. And then we also look at malignancies and cancer. We've also got gynecology and breast disease, so that would include both benign and malignant breast and ovarian conditions, but then also diagnostics and treatments of all these different diseases. Then we have core clinical immunology, which I liked it, but that was just, again, too much information on the slides. It was way too detailed for my liking. So we learn about the immunocompromised, autoimmune diseases, allergy, transplant medicine, immunosuppression, immunomodulation. So it is cool, very, very detailed, but not as detailed as hematology, which is the biggest topic in clinical pathology. I think it makes up about 20% of clinical pathology. So in hematology, you learn all sorts of diseases of the blood, from anemia to cancer, in very, very thorough detail. It's a vast, very detailed topic. And we also do cardiovascular pathology, so diseases of the heart and the cardiovascular system. We do gastrointestinal, hepatobiliary and pancreatic pathology, so basically digestive system diseases all the way from the mouth to the anus. We cover skin and musculoskeletal pathology, so that includes diseases of the skin, connective tissue, head and neck diseases like cancers, bone disease, and a lot more. And then we finish it off with core clinical biochemistry. So that includes things like endocrine disease and diabetes. So as I said, we started control and movement in term 1, we finished movement in term 2, but then in terms 2 and 3, we do control. And control was the best part of second year. I absolutely love learning about the human brain and the human nervous system, really. And I just love neuro. I mean, personally, at this stage, I want to go into neurosurgery. A lot of my research work, for example, is very much concentrated on that. So absolutely love learning about the brain. So in control, we're very thoroughly taught the anatomy, sort of like cranial anatomy, so that includes the skull and brain, and then the spine as well. And then we learn to actually interpret brain scans to differentiate between 4 major types of hemorrhages in the brain. So let me see if I can get this right: epidural, subdural, subarachnoid, and intraparenchymal hemorrhages, and then also different types of tumors and cancers of the brain. Then we also learn a lot more clinical stuff like degenerative disc disease of the spine, called equine syndrome, and then other neurological emergencies like stroke. And then we also cover things like seizures, very comprehensively actually. So they teach us many different types of medications for seizures, contraindications for all of these sort of like medications, and then also how different seizures can present. So very, very relevant, very interesting stuff. So I think for the vast majority of the people in the year who don't want to go into neurological medicine in the future, everyone really enjoyed control. I mean, even the people who want to go into orthopedics, I think they said they really enjoyed learning about neuro more than musculoskeletal. And that's partly also because the medical school teaches anatomy, physiology really, really well, like I already said. I mean, control was just absolutely amazing. I mean, going to the anatomy lab and seeing the human spine, the brain, and actually being able to touch it, it's fascinating, just brilliant stuff. So more in term 2, we start a new module which we already had in term 1 called Individuals and Populations. So we learned some very interesting things this year. So last year in year 1, Individuals and Populations, also known as IMP, was very much about psychology and development, which I absolutely loved. And this year it was more concentrated on public health. So as a doctor, you're not just taught to treat and understand disease, but then public health also looks at much broader things, for example, like socioeconomic and social factors that influence disease. So public health is very, very interesting. I think the lectures were very well delivered. So we're taught things like biostatistics and epidemiology. Some people didn't enjoy it all too much, but then also I think it's absolutely fascinating if you attend the lectures, and I didn't attend all the lectures, I absolutely did not, but I did go out of my way to watch the recordings online afterwards. They were uploaded. They were just that interesting and well delivered, so it was a good module, really enjoyed it. Then in term 2, again, placement continues, and in term 1 we also have an exam which is called the formative exam. So the formative exam, even if you get 0% on, that's completely fine, it does not matter. The formative exam only really exists to show you where you currently stand. A lot of people have complaints from formative exam. I mean, it was only 60 marks. We didn't even have 60 lectures that year, we probably had like 200 by that point. So you cannot test 200 lectures worth of content in 60 questions. It was absolutely bizarre to me and to the whole year, really. So when you get your formative results, once you've sat them, take it with a pinch of salt. You know, from each module they can only ask you a handful of questions, so it's not very, very representative of your knowledge. So yeah, just don't take the formative too seriously. But with that being said, so what I mean by that is don't stress out over it or anything. But then, yeah, I guess it can help you gauge where you stand currently, to some extent. Okay, so moving on to term 3 and the final term of medical school. So, like I already said, we continue control the movement, we continue control, so we continue learning about neuro, and it's really enjoyable. Now, unfortunately, term 3 is also the term when we have our summative exams. So this is when things are very, very intense. I mean, everyone's spending all their time in the libraries, everyone's become very serious, no one's really socializing at all. So control is going on, and then clinical pathology is still continuing, and the last few topics that I talked about, clinical pathology, they're now finishing them. Individuals and populations, so IMP, they're still continuing that as well. Now, placement is still going on as well, which I personally wasn't a very big fan of. Just like a couple, 3 weeks before exams, some people had to go to very far places for their placement. Some people had to go to Huddersfield or Bradford. And I really do feel for the people who had to sort of like come back home very late and then study. But then I suppose the point of all this is they're trying to give us a flavour of what years 3, 4 and 5 will look like. I mean, in year 3, 4, 5, we won't exactly be given study leave. We have to balance studying and placement throughout the year, so it's something you've just got to get good at. So I do understand where they were coming from, and I also do see that stressed and upset a lot of people, and I just hope everyone's exams went okay. So then in term 3 we have the big summative exam, the final exam that's going to test your knowledge from the whole year. Fortunately, this exam was not 60 marks, it was 240 split over 2 exams, both in the same day, which again, in my opinion, is a bit of a mistake. A lot of people do like that, we're getting it over and done with in a single day. I would much rather them have it done on 2 separate days, just so that you get a bit of a breather. So exams happened towards the end of May, and then in the start of June, in the first week of June, the year ends with a post-exam placement. So whatever your first placement was in term 1, you will now have a 4-day placement, and that's just very, very boring. Now, a lot of people didn't enjoy that much because, exams have just gotten over, people want to relax, they want to go out with their friends, they've got holidays planned, but then the university has given you 4 extra days of placement. And I understand again where they're coming from, because in the future there's going to be exams throughout the year, but you're still going to have to do placement right after these exams are done. That's annoying, but hey, that's just the way it is, I guess, and that's just the way it is. I think it's very standard throughout all medical schools. So I will now show all of you my exam results, being completely transparent. So firstly, just a bit of background. At the University of Leeds, we are graded not in first, second class, whatever. We are given actual grades like letters, so A all the way to F. If you get an E or an F grade, then you do fail and you have to resit. If that does happen to you, then you have to do a resit exam in August, and then if you are able to pass that exam, which is the case for the vast majority of people who have to resit, then you move on to the next year. If you fail the resit, then you are, I believe, given an option to repeat the year. So this year I got between 75 and 76%, and that equates to a grade B, and I'm quite happy with it. Honestly, I'm very, very happy with that grade. Now, obviously in the start of the year I desired to get a much higher grade, maybe something like 90, 100%, but that did not happen for very good reason. So firstly, I actually spent a lot more time doing research rather than actually really studying for medical school, which I do not regret doing because I've gotten a decent grade. I'm quite happy with it, but the reason I've been doing so much research work is because I want to go into neurosurgery, most likely, or some sort of competitive academic surgical field in the future, and it's becoming harder and harder to get a spot there every year, so things like research really does matter. But then outside of that, I'm not just doing it as part of some sort of like requirement. I love research. It's a passion of mine. This year I was also awarded this thing called the Excel Scholarship, which I'll probably make a video on in the future, to do research, and I love it. It's a passion. The ability to sort of like contribute to scientific literature and knowledge as a student is a remarkable opportunity. I think everyone should try it. And that took an awful amount of my time. I mean, genuinely, it took so much time of mine. And yeah, for sure, I mean, I got stressed out when I had to balance that and then actual medical school. So yeah, things definitely did get hard for me. And then also I was juggling things like training archery, going to the gym, which unfortunately didn't happen a whole lot in second year, especially in term 2 and 3. Then balancing things like some of my physical health, like running, swimming, which I actually did quite a lot of, and then socializing. And honestly, my social life definitely suffered compared to year 1. And year 1 was so much fun. In year 2, yeah, I did do things with my friends, but not that much, which I do want to change in year 3. I mean, at the end of the day, if you're not truly happy, not having fun, you're really going to struggle with the course. Medicine is an intense course, and I've heard this from people in the year above. When you start clinical years, things can feel very sort of like isolating. You can feel alone, you can feel upset, and it's important just to like look after yourself mentally, that kind of thing. So anyway, looking at things, so EMS I got almost 85% on, control and movement I got like 77% on. Movement I did quite well on. Control, which was the neuro stuff, I did not do very well on, even though I loved it the most in the entire year. The reason is I neglected the last few topics of neuro because it was too close to exam dates, and I was juggling some of my research work, which that part was a bit stupid, but I also made so many stupid mistakes in the exam. There's things that I absolutely knew, but I put the wrong answer for, just based on sort of like overthinking, which is so stupid, and it's a very bizarre thing that I did that. But anyway, clinical pathology I got almost 73%, and then ENQUIRE, ideals and cares that I didn't really prepare for at all, to be honest. I just couldn't be asked. I got 65%, which no surprises there, to be honest. And then IMP, I've just realised IMP was my best module in the year, which was 86%, which I'm very happy, very pleased with. So again, could I have done better if I sort of like did a bit less research? Yeah, absolutely. But I have no regrets. I mean, 75-76% is a very, very good grade. At the University of Leeds, if you get an A or a B every single year, you will graduate with honours. Which is something, I mean, I'll take honours. I mean, so far I've been getting, at least a B in every exam. I haven't gotten more than a B yet, but that will change. But then also I will say, and I am going to make a dedicated video to this, what I have realised is getting the top grades will not matter that much as having a holistic sort of like application when you're applying for higher specialty training would matter that much. So things like publications, research, teaching, audits, extracurriculars, those matter so much more now. Your grades don't alone matter. So it makes sense to concentrate your efforts where they matter, and that's why I slightly neglected studying, although I did quite well. I'm really happy with it. So now I'm going to go through some things, again, just very quickly, things I loved about year 2. And again, the strongest and most attractive component of studying medicine at Leeds is how well neuro and musculoskeletal medicine are taught. Very, very well put together team. The anatomy team is very wonderful, they're very approachable, very kind people, and they make the sessions very engaging, very thorough. They've got lots of sessions, many lectures, many opportunities to learn more, and yeah, anatomy spread out throughout terms 1, 2 and 3, so it doesn't feel rushed. They've done things at a very good pace, and it's not just anatomy, as I already said, it's all very well clinically linked too. So again, like I said, we learned things like stroke, MRI, CT heads, cranial and spinal emergencies, seizures, epilepsy, peripheral vascular disease, hip fracture management, shoulder dislocation, and then so much more. So I really like the fact that we had placements this year as well. Again, like I said, it is very annoying that they had it close to exams, for some people especially. But yeah, placement good. I had fun. The University of Leeds offers a lot of extra mental health support with people who are struggling. They offer it so much. I mean, they're always shoving mental health support in your face, which is a good thing. That came across badly. I've never had to use these services, fortunately, because I think I've been very well the last 2 years, but I do know people that have, and their experience with the mental health support team at Leeds has been absolutely wonderful. So I think that's a very nice thing. Another thing I really liked about year 2 is you have the option to do lectures online, so you can just do it from home. So very flexible, which I quite like. And I will be honest, I did not physically come into the majority of lectures this year. I would come in mostly for the social aspect, because you want to see people, sit down with them, go through the lecture together. That's always nice. So I've already covered a bit about the things I didn't love about year 2. So things like the PPIE that they had at the end of term 1, complaints about ENQUIRE and how they could have made that better. And I'd like to talk a bit about revision techniques for year 2. So on this channel, I've already talked a bit about things like active recall and spaced repetition in some of my videos that I'll also link in the description. Very helpful things, and I've talked a lot about Anki. Now, Anki is obviously super wonderful, making flashcards and then reviewing those throughout the year. I did quite a lot of that. I think Anki is the most popular way to study in the year, across medical schools period, really. And yes, I have made a video covering Anki already and how it works. If you don't use Anki, I think you should be open to trying it at least. And Anki works really well for things like anatomy. One very good study tactic that I started using in year 2 was using AI. Now, I do not think the rise of artificial intelligence is a bad thing at all. We have it, it's here. You should make the most of it. It's so useful. Tools like ChatGPT are absolutely amazing. You can literally get ChatGPT to generate questions for you and then get it to test you on a subject. You can upload files to ChatGPT. You can literally upload your lecture slides to ChatGPT and get it to test you on that information. I will be making a video covering how I did that in more detail. So that's very useful. I mean, people learn best, and so many studies have shown this, through testing yourself. You learn best through actively challenging and testing your brain. And So figuring out what you do and don't know, and that's done best through testing yourself, so question banks, or just asking ChatGPT to generate questions for you based on the syllabus, all very, very good things. The best revision technique that I can really give you is consistency. It's hard to cram medicine. I did not really cram, I did space out my revision, and although I didn't go super hard when it comes to revision in terms 1 and 2, because I was really doing my research stuff, I did stay on top of things, I did stay on top of my flashcards, so it is important to space out your revision and be consistent with studying. That is exactly what will keep you sane, because when you've got a cram towards the end of the year, it's a horrible feeling, and it's just don't do that. I think trying to cram year 2 is futile, it's not very smart, and you will burn out very quickly if you do that. It is a stressful, difficult year, so take your time with things. Medicine, again, it's a marathon, not a sprint. So I hope you enjoyed that video. If you'll be coming to Leeds medicine at any point, if you're thinking of applying, if you're coming this summer, or if you've just finished year 1 and you're now coming into year 2, tell me what you think. Leave a comment down below and just let me know what you thought of the video. How can I do things differently when it comes to making my videos? And with that being said, I wish you all the very best for med school and for second year of med school. It is tricky, it is a lot, but you will get through it. Just believe in yourself, do your best, and work hard. Good luck.